Greetings of the day, everyone. I am privileged to welcome you all to another episode of our Health Talk series organized by the Student Council of Sadabai Raisoni Women's College, supported by SGR Knowledge Foundation and powered by Raisoni Group of Institutions. Good sexual, menstrual, and reproductive health is important for women's general health and well being. It is central to their ability to make choices and decisions about their lives, including when or whether to consider having children. Sexual, menstrual, and reproductive health is not only about physical well being, it includes the right to healthy and respectful relationships, health services that are inclusive, safe, and appropriate, and access to accurate information. It also includes effective and affordable methods of contraception and access to timely support and services in relation to unplanned pregnancies. Today, we are joined by Dr. Sushma Deshmukh, a consultant gynecologist, infertility specialist, and hysteroscopist, alongside holding numerous designations, who is also an active advocate of public awareness of health and education. She serves as the director of the Central India Test Tube Center, heads the Getwell Super Specialty Hospital and Deshmukh Hospital, and presides over the OB-GYN Society of Nagpur. Aside from that, she has authored several books on hysteroscopy, infertility management, and public awareness, about which we will speak to her today. She is no stranger to conferences at both national and international levels, where she participates regularly as a faculty. She also runs a Garbhavati Garbh Sanskar unit and is the director of the PCOS Club of Central India. Ma'am, that is a hugely impressive profile that you have right here, and I cannot be more honored to have you speaking to us today. A very, very warm welcome to you. I'd like to pass over the session to you so that you may speak to us about your achievements, your work, and the small presentation that you have for us.
Thank you very much. First of all, thank you very much, Arifa, for giving me the opportunity and this Raisoni group for sharing my views about all these things. You know, this phase is very important. The adolescent phase and the teenage. You know, adolescent, what I always say, getting feeling of adult. That is adolescence in a simple way. So many things are happening in our small world. And there are so many questions, so many queries. And many times we see that to whom we can ask. Doctor may be busy, parents, or easily they can go to the net. Okay, internet. It's very easy access. But friends, I always call them my small little friends because there are so many things. Your complete future depends on these things. And the health comes first, which is very important. And I'm working for this since 25 years. Since my beginning of my career, I decided to work on that. Though I'm an IVF specialist, I'm running test baby center, I'm hysteroscopist, we'll be discussing about it. But before that, and I have written many books, more than 25 books on this awareness and all these things, and even academic books also. So I would like to share this knowledge to my all the budding these girls who are going to achieve so many heights. Okay. So that's why we'll just start the discussion. Then we'll have a lot of questions and answers afterwards. Okay. Is that okay?
Yes, that's wonderful.
So I will start sharing. Okay.
Yes, ma'am, we can see this.
Yeah. So especially I designed this as a youth, health and you. So it is dedicated to all girl students. So welcome to all students of the colleges of Raisoni College group. And now we'll be discussing this very small things. It's not moving. Yeah. You know, I always say woman present in all walks of life. You know, she creates life. Why so much importance? Because she creates a new life. She brings up that life. She puts colors and gives shape to it. It is dedicated to all age group females. You can see any house when a small girl child is there, when an adolescent girl is there. So many, you know, the home is like a haven. So WHO expert committee, as a World Health Organization, adolescent is 10 to 20 years. Because why it is important? All morphological changes are occurring in our all organs and systems. Okay, so many changes, the physical changes are there because there's a pituitary gland is there. You must be knowing the pituitary gland. I will show you. And it secretes some hormones and it will act on the gonadal system. There's ovaries. The uterus is center and the two ovaries are there. I will show you the figure also. And so the mental and psychological development also occurs. Youth, already I mentioned it, 15 to 24 years. It is one stage of adolescence. I think you are in the age group of 18 to 24 years, right?
Yes.
Okay. Yeah. So these are the budding citizens of India. High hopes and expectation from society, and they are on the turning point of their career. And now we doctors are concerned about the general as well as reproductive health, which is very, very important. So this is I was mentioning about you. See, this is uterus. Okay, remember I'm going to just mention afterwards also. This is the, this is outer layer in the other problems like PCOS. So estrogen always in upper hand because it's basically female hormone. Okay, so the pituitary gland is there in the brain which secretes some hormones, stimulating hormones which act on the ovaries, and we get the estrogen in our body. That's why the girls get that characters from the, and it starts happening from the 10th year, from the age of 10. And then afterwards, there are some changes. So that 1 or 2 years after the menstrual cycles, the ovaries are somewhat quiet, but afterwards they start ovulating. Every month, one egg is released. This is very important concerning to your reproductive health and the contraceptive pills and all this what you want to discuss with me today. So every month, one egg is released around the time of around 12 to 16 days. Okay, in the midst of the cycle. And this egg is released and this egg is picked up by these fallopian tubes. It will be released from either right or left. So you can remember this much. Okay, then the problems of youth concerning the medical, social, career, stress, competition, exposure to modern era and failure to cope up. Okay, these are the multiple problems that we come across with this youth because now there's a very much large percentage of youth, they are coming to us with so many problems. So we'll discuss one by one. Medical, with the very most common is the menstrual problem. So many girls having the premenstrual syndrome. That means they get disturbing things. They get breast engorgement before menses. Okay, they get irritation, irritability. So these are called of premenstrual symptoms. Then the menorrhagia means increased heavy flow, and dysmenorrhea means the pain during the menstruation. So these are the things, and another is a polycystic ovarian syndrome. We are going to discuss in detail. The nutritional deficiencies, diet, and psychological problems, they are very much common in this age group, and teenage pregnancy. Nowadays, we are getting less these things, but still we do get these pregnancies, and we need to know because you should all need to know all these problems which are happening. Now coming to the PMS, menorrhagia and dysmenorrhea. See what are the questions? We'll be like this question answer. My daughter is in college. Whenever she gets menses, it's very difficult to manage her moods and she is having heavy bleeding. So there are two problems. She is disturbed, psychological disturbed, and she is having heavy bleeding. Okay. And sometimes she get pain also. That's a dysmenorrhea. So what are the reasons? See, absenteeism from school, colleges. See, so many things are there. Then what is happening in her life? See, what are the stressful conditions in her life? Exams, many of girls, they do get problems during their exams. Even though menses come earlier, even though they get extended, so many things are there. Even you are having interview, still you are worried. And again, it's because, everything is hormonal. And the psychological, it depends, everything goes hand in hand. Even while touring, some are good players. So while they're touring, they are getting these problems. Even before marriage, after marriage, these problems are there. And again, there is a burden of monthly pain and bleeding. So absenteeism from school, work, colleges, they are unable to enjoy their life, anxiety. There are so many girls are coming to me with these problems. I always tell them, I will tell you how we treat them. Then behavioral problems. Always they are coming with their parents or the mother, and she says that she's getting fatigue, she's a fatigue, dizziness, and she's tired, Then loss of sleep, insomnia means it is unable to sleep properly, overeating, then the food cravings, eating chocolates and ice creams and
Yes.
whatever, and like this, so many problems and excessive sleep. So these are the behavioral symptoms, but psychological also there, irritability. What if you are, if you can just imagine or you can understand, you can witness also. Sometimes you have witnessed, must have witnessed. So your friend sometimes unnecessary is irritable, sometimes unnecessary she gets covered, unnecessary she will shout, depressed mood swings are very common, anger, anxiety. So we should understand what is happening in your body. Then physical symptoms, water retention, that are already premenstrual symptoms, headache, abdominal pain, then breast tenderness, nausea, back pain. So many things are, lot of, there are, the list is long lasting, but still you have to conquer it. How you are going to manage it? Generally, we explain them. So self-care is very important. Complete English is okay, na? No problem, na?
Yes, ma'am, absolutely. You can continue. Yes, please.
So you have to explain and reassure. What we always say, ki, see, baby, this is going to happen. Not to
Mm.
worry. Okay? These things are there. You have to take it lightly. This is a natural thing. Okay? Relaxation and meditation. And we always tell them to get involved in some sports activity, some yoga activity. Okay? Then proper diet, proper nutrition, rest, then dietary some changes, not to eat so much sweets, light exercise, and this yoga. And one thing is always we say that this is a dictum. What this is about the regarding the disturbances, mood disturbances, and the whatever the things, psychological disturbances. But sometimes they get pain. Every time the girl will come with the pain. And there is a very good dictum in our this. The dysphoric mother will have a dysphoric daughter. That means it has a 40% psychological basis.
Mm.
60% they are having real true pain, but some are having, because they have seen since their childhood that the mother is having such like pain like this. And many times they feel like now I will also get pain like this. And with then the tolerance may not increase. So that's why they need proper explanation, reassurance, which is very, very important. Now coming to the very important, because you will get all these problems in this group, which has become a burning issue of the world. That is a
Mm.
polycystic ovarian syndrome. What is it? We are going to explain, because nowadays it is actually a need of our to explain all these problems, because a lot of girls, they are getting this problem. There are loss of hair on the skull, acne and hair growth over the chin, even the extremities, hands and these legs. Then the obesity is around 70 to 80%. They are coming with the irregular cycles. And these problems are merged with the adolescent phase. That's why it is very difficult to make out whether if a girl is suffering for PCOS or she is having her adolescent problems. But
Mm.
with investigation, we can make out it. Okay. And there's many times, already I mentioned you, there are hormones. Estrogen is the male hormone and testosterone is estrogen is the female hormone and testosterone is the male hormone. So there is a
Mm.
balance. Estrogen always in the upper hand. But due to this problem, the male hormone will be increased. There will be imbalance. That's why the girl will have a increase hair or the chin or the upper lip. So these are the reasons. Okay. Now this is a question from a girl. Doctor, I'm 18 years old. My weight is 85. In last years, my weight has increased from 60 to 85. I feel depressed. Please let me know the way out. Another, I'm 20 years old college girl. I'm getting growth of hair, my lips and chin. I feel low esteem. What is the solution? So these are the questions nowadays we are getting. So these are the questions from your colleagues only. So solution is the lifestyle management. So what is will just see? We are working on that PCOS Club of Central India because we need to understand this entity, and the girl should know, because this PCOS will start from the menarche, means whenever the menses starts, and end with menopause. That means it will be throughout the reproductive age, and around 45 50 it will end, but it will have a long lasting effect in the later life. Okay, that I will explain you. So that's why the girls need to understand this problem. So this is simplified. See, we call it the for femininity, because all the feminine characters, they will go like this: irregular amenorrhea, when the girl will not have menses, then the hairs on her body, chin, okay, even this blackish discoloration, then the hormonal abnormality, heterogeneity, increase in the androgen and the testosterone level, emotional instability, menstrual abnormality, and obesity, and later on going to the infertility, which means childless problem. So, and this thing goes on, it will disturb in her pregnancy in the later life. The name is PCOS. Why it is important? Is the most common disorder, affects millions of women in the world. In India, the percentage is increasing. Even see, you can see the 22.5% from 3.57. So many times is more than that, because of the mismanaged lifestyle. What is PCOS? Polycystic ovarian syndrome. There is a hormonal imbalance which causes multiple cysts to develop in the. It is not actually cyst. These are the small follicles in which there is an egg, but it is not developed. It will get suppressed. So there will not be ovulation. What I explain you, every monthly there is a ovulation. Okay, in between the midst of the cycle, the one egg is released. That is exactly not happening in PCOS. Okay, the cause is not known. The many girls, they ask me, madam, what's the cause? It is not known. Genetics, sometimes there is a genetic cause, sometimes increased amount of insulin, and obesity is also there, which can again play an important role. And another one important, mismanaged lifestyle. See, you girls don't exercise nowadays. Many girls I see don't exercise, don't eat proper food. They are happy with the Zomato, Swiggy, online food. They are they'll enjoy like anything. And they don't like the homemade food. That's why these diseases increasing and increasing, because of the mismanaged lifestyle. What are common problems? Irregular or absent menses. See, you can see the girl with the hairs on or the chin. Acne. Acne is also a very common feature of adolescent age, but it is very common in PCOS. You can see the pimples. Okay. Then the excessive hair growth on the face. You can see this thing. Then this condition. See, many of the girls, obese girls, they are having blackish discoloration over the back of the neck and the axilla. These are called as the acanthosis nigricans. This is also due to the insulin resistance. Okay. Weight gain. Diabetes can be there in after 10% of the PCOS patients, so you should be aware. And the metabolic syndrome. So we'll go in detail afterwards. Now we'll just cover some, because it's a very vast topic. We can't discuss in half an hour. So I'm just describing the thing, not to get afraid, not to get scared of all these things, but you should know what will happen. See, infertility is affecting nowadays many patient of the women, because because there is no ovulation is happening. Very simple reason, there are multiple cysts are there, multiple follicles, and the egg formation what is normally happens in every month, which is not happening. Very simple reason. That's why they will have this problem. Okay, treatment is diet, exercise, and medicines. Proper diet, that I will explain. The medicines that we'll discuss in short. Afterwards, so I am going to discuss you. OC pills are very nice nowadays in polycystic ovarian syndrome. They will improve the menstrual cycle, irregularity, then the excessive hair growth, and the acne. Sometimes we need to add the insulin sensitizing agent like metformin. The girls or the girl parents may feel that my daughter is having diabetes. It is not like that. It is because of these insulin resistance there. That's why we are giving this medication. Okay. Then sometimes anti-androgens. We need to control the excessive hairs like that. So we are adding it. So now acne. Now this is very common that I would like to mention. Sometimes 50% you can control your 50% acne. Wash your face regularly. Okay. And avoid skin irritants. Then see how you have to wash. Just you have to lightly, gently, just just apply the soap and just apply the water like this. Okay, not rub it or squeeze the pimples. You have to be handle it very delicately. If you try to just with the nail or like that, it will create infection and it will have a black spot. So many of the girls, they are having black spot or because they don't understand. They just rub it and this nail infection, it will go there. So it will have a pus formation. So not to just touch it all constantly. It may be irritating, but consult your doctor and just maintain this protocol. Just wash the face regularly 4 to 5 times a day. Then apply very gentle soap and just mop it like this. Don't rub it. Okay. Then the diet. Diet, there are two important. There are some, you must be surprised. There are lean PCOS also. 70 to 80% are obese PCOS, means fatty, and the 20% are with the lean PCOS, means the thin PCOS. Because already I mentioned it is genetic, it can have another problems, insulin sensitive. So these are the reasons. So it is a combination of all the problems that will cause PCOS. So proper diet. So how many girls I would like to ask, they are get up early in the morning or they will exposed to sunlight? It's a very important question I always ask. And the answer is, you must be knowing. Because
Yes.
girls, they are not getting up earlier. They are forgetting our original culture. You have to get up earlier and you have to go to bed earlier. If you get up early in the morning, normal first, because these PCOS girls, they will have a vitamin D deficiency. Because they don't get exposed, then it will further increase their PCOS. So you have to get up early in the morning and you should have a proper diet. Then you should have a sprouts, properly green vegetables, then the all fruits, salads and everything. Avoid junk food because always there is a stomach upset. So you always respect your tongue, okay? But there will be stomach upset. Very simple. So don't always respect your tongue because it will cause stomach upset. Have a belief on your proper nutrition because all you girls, you know the proper food. You know the proteins, you know the proper green vegetables, all vitamins, but you don't apply. So there are two group of girls. Those who do understand everything but don't want to learn, don't want to apply on regularly. And the zero figure, unnecessary, they will get devoid of nutrition. They will have a, they will want a Karina like figure. Don't believe on that, all these things. You have to be on your side, have a proper nutrition, consult your doctor, and you will have a very good your diet. Okay, and nice health. So see, these are the fruits, vegetables, pulses, frequent and small is proper breakfast. Okay. Then avoid all this fast food in your life. Avoid all these things. Okay. Deep fry it. Then drinks. This is becoming very common. Many of my patients, they tell me, they confess me that, madam, I regularly I'm having drinks or cigarettes. Even the patient admitted with me, the girls, they used to smoke in my chair, these rooms also, admitted rooms. So this is very pathetic. I also feel very pity. They should not do like this. They are spoiling their life. So avoid all these things, hard drinks, even soft drinks, smoking, deep fried, exercise. Just avoid all these things. Have a now exercise. There was an important study in USA. There's a conference, and what they were saying, okay, now there is a lot of stress in all these young these adolescent girls and boys. So what is the solution for that? So there are two things. If you want to avoid it, they suggested sports and spirituality, adhyatma. So I think you can apply the sports Adhyatma is good, spirituality, but for your young, all these young girls or all the young boys, sports is always better, for mind and body control. It's a very good activity. Then discipline, time management. Then हार जीत का जो रहता है ना, sometimes you get failure. You can very well cope up with these sports activity because you are used for that. हारना है, जीतना है, हार गए तो फिर से उठना है अपने को. So this always happens in life, always, at any age of life. It is not like that in only student type it happens. So you have to be like having a sportsmanship spirit. And if you are having a very good group, those who are involved in sports, they will easily understand what I am meaning. So always have a proper sports, and just idiot box TV. Then now what is there? Mobile. So many things are there that I will explain you. Oh, mobile. Just avoid mobile also. Just don't be a slave of mobile. हमेशा मैं बोलती हूँ कि मोबाइल का गुलाम मत बोलो, मोबाइल को गुलाम बना दो. What you are doing constantly, you are on mobile. You are having your health is affected, your eyes are affected, your mind is affected, your creativity is affected. So many things are happening. Really, you don't know what are these radiations are creating. So exercise regularly, brisk walking, jogging, often. Then take a stairs, not elevators. Okay, increase your activity. This is very important. Then social. This always I give. See, you have to be with your family. Only your family can care you. Though your friends are there, you can have lots of friends. Friends are also caring, but your parents, you respect your parents. They are always there. And then avoid fast food culture. Because nowadays what is happening? No communication, no hobbies. So these are the social things that we are facing with these girls. Then the stress, coaching classes. Just see how many of your girls having tuitions constantly, because I always ask them from 6 to 7, 6 a.m. in the morning to 7 or 8 p.m. they are busy. I always say them, you are busier than me. So it is not possible. Actually, one cannot study like this. You should have half an hour for your this relaxation. You can play games. You can have a sport activity. You can have anything. You can have someone have cooking hobbies. You should have your hobby for half an hour. It will refresh you. One cannot study for long hours like that. So it's a stress. Then competition. Again, it will, if you don't have a competition, it should be a healthy competition. Deadlines. Don't get unnecessary the deadlines. You should have a comfortable life. And career struggle for survival. Though see all these things are there. Just think on that at the end of the day. Think what I can do, what is the better for me, and then you can avoid your stress. Always there should be stress busters. Like your family, your friends, your siblings, they are your stress busters. So be with them. So you will feel very comfortable. Now you are exposed to modern era like TV, internet, mobile, free culture, late night parties, dance parties, addictions, drugs, hookah. Am I correct? So all these, because I'm coming across even hookah girl. I have come across a hookah girl. All addicted girls. Then they are confessing that they are having late night parties, free culture. So many things are there. So I don't mind, but always you can enjoy, but be comfortable. You have to think all these things and stick to your family, follow your family norms. Our Indian culture is the best. You have to follow that thing. Don't get attracted towards Western culture. This is an important message for you all girls, because finally your health is affected and the female is the one who gets suffered. Remember my word, because I have seen in my OPD, lot of girls, they are suffered like anything. And then they get, after that, everything is finished, then they start thinking. Always I think, just think over it, what you are doing. Due to the failure cope up because due to modern gadgets, distraction, attractions, behind short gains, bad habits, depressions, and suicidal tendencies. See, because they are not getting coping up. So many things are happening in their small world. So think about that. So the one where technology has simplified our lives, but we no longer lead a simple lives. Okay. So most important aspects, good or bad, think about mobile, internet, movies, freedom, gender sensitivity. So mobile is known for decreased creativity, that you also know, because it's a copy paste ka zamana hai. When there is a essay writing, immediately we start searching.
Yes.
We never think ki what I should write, what I even the reading habits are decreased. You should have a very good reader. You should start reading the novels and your cultures. So you will develop your own language. You should start your own thinking, which is very important message. Again, I would like to give you. This reading culture is disappearing. It should not happen. So you should have a proper this thing. You should understand your what is you have to do. Then wrong sites. Many times you go on searching on internets and you go to the wrong sites and get trapped. So always be aware. Facebook, WhatsApp, very very dangerous sites sometimes. Bad movies, misinterpretation, sexual relationship. Always avoid all these things. Teenage pregnancy. You can have a better life. You are going to have everything. But now it's your career. Concentrate on your career. Why you are distracting yourself? Then the gender sensitivity is another side. We'll discuss it. See the mobiles, how they are engrossed. Everything there on mobile. Even they study with the mobile. Everything is. They just don't bother also. Where even they are not noticing what is happening around us. So many mishaps have happened with the girls. Just not. You must have noticed. You must be knowing the so many news. Even the rapes have happened because they are sitting in the taxi, not very not alert what is happening around. So you have to be very careful. Further, it is not so easy. We see the outside world, and the child abuse is becoming more common. Relatives, friends, unknown person, because easily available, very easily they can they can, the girls are very sensitive and very they can believe easily on others. That's the main problem of girls. They are very, emotional. So sometimes I feel this is the main aspect. So you should not be, you should have a practical, you should be practical and you should be your career oriented. You should stick to your family. And the many times what is happening, some problems are there, nuclear families, loss of rapport of parents. So it's the main problem. So we have to be very careful. Then freedom, gender sensitivities are the main problems. This is the act of being sensitive to the ways people think about gender. So gender is a spectrum. Gender, what a person identify himself or herself as according to socially constructed roles. So gender roles determine how males and females should think, speak, dress. So I think one should think about it. Is a very different topic to discuss. But like your life, sanskar, follow your sanskar, discipline, proper rest, exercise, nutritious diet, timetable about studies, respect to seniors, let your mobiles and net have a rest, and aware of distractions. Okay? You should have a friends with the girls, boys, everyone, but there should be some distance in between the boys, and it should be a pure friendship. Don't go anywhere with the unknown places. Okay? Then if you are going for Navratra, you want to celebrate all these things, be in a group. Be aware about whatever you are wearing, your outfits. So see, you can't say like why they should say like that unless and until our system is different. If we are living in India, so we have to understand our people. Okay, then the proper diet, and the most important is you should be very noble, self-introspection, respect to the elders and your teachers. Okay, now these are the few questions. See, my mother wanted to know everything about me, especially how I thought about the things, and it drove my nuts and felt kind of invaded. And as one day I screamed, stop trying to get inside my head in the world. So I always say, be friendly with your parents. They are your caretaker always. Okay? Develop your hobbies, be positive thinking. Friends boost up my confidence because they know me best. They think that my friend know me that I am the best. But always have good friends around you. Okay? As a young girl, I followed my father around in the house when he was fixing the things. How many girls they do? They always observe their mothers. I always tell them, whether how many times you have helped your mom, and they say that we always been studying, we don't have time. How many times you have talked with your mom and asked about her childhood? The answer is many times no. They are not knowing anything. So don't do like this. Always talk to your mother. Always see how uh, simple things she fixes. Simple things, and it will help you a lot in your future life. Okay.
Yes, ma'am, I'd like to remind you that we have 5 more minutes left, and
Okay.
also I have a bit of an issue with my WebEx. I'll just rejoin quickly. My
Okay. No
screen is
problem.
frozen up.
Okay. In five
Yes,
minutes, I
just
will
hold
just
on
have
for a minute.
almost. I'm on the. To help
Yes,
yourself,
just.
develop your persistence. Be sure in what you stand for. Okay. The
Hmm.
media and images affect my life to the point it goes silly. Always, there are always people slimmer and nicer looking than, and it knocks my self-esteem. Don't always compare this advertisement and the movies and like this. They are different. That is their profession. I always explain you. Extreme lean and extreme obesity is not good for your health. And don't you think about yourself and proper nutrition. My daughter is always afraid of failure. Don't be. You should be responsible for your own success. And failure lights the path of success. Remember. So build up your own confidence. Decide your own aims. Don't be also run houses. Just all are running. So I should run like that. Don't do like that. Proper diet, exercise. Then the increase your outer beauty as well as inner beauty. It is very important. You should be beautiful from inside. Always I get attracted to other things other than studies. I don't like to listen always. It happens with every adolescent girl, but respect your teachers, parents, learn the forbidden zone like alcohol, gutka, drugs, sex. Try to go with your wings with the whole world will be yours. Help yourself to bring out the beautiful woman hidden within you. Then I will discuss it. Then to awaken the people, it's a woman who must be awakened. Once she's on move, the family moves, the village moves, and the nation moves. Very good. This saying by the Pandit Jawaharlal Nehru, our first Prime Minister. Be calm, quiet, tranquil, and stay close to your family. Life is very short. Please, while you can take time to enjoy all the pleasures that God has provided to you. Be calm and tranquil. Thank you.
But I think we can move on to the questions now. Can I
Yes,
ask you a few
sure.
questions
Yeah.
about, yes. So I'm firstly, because you're so active on the public awareness front, in terms of propagating awareness, there must be a certain backstory, like where it all started from, what made you come out there and come with so many books. And I think you've also written a booklet called Sakhi Arogya Samvad. So what made you start all of this, like venturing into public awareness?
So, well, it's a very good question. The story has started 25 years back when I
Hmm.
started my practice.
Hmm.
When I started my practice, I always, that time the crowd was different. That time the no internet, no mobiles. It was that era. That time more than 50% of the women, they are not aware of their health. Whenever I used to explain them, they used to say there is no need. But sometimes what used to happen, many complications. Suppose for a girl,
Hmm.
irregular bleeding, then irregular problems is then what happens, the hemoglobin will go down, and the parents will think that it happens, this in this area, this age group. So when it is severe, then they used to come.
Hmm.
Sometimes the in pregnant lady, there are some complication, irregular visits, and they are not knowing what is to be done. Even the elder age group, more than 40 years, suppose there is a bleeding, that's a this is a high risk age group. So they need to understand the cancer is there. So many things are. Suppose a simple breast nodule, it is very common in the reproductive age group. You should be aware of that thing. You should know whenever there's a breast nodule, you should visit to a doctor. Or don't run for other pathies. All pathies are good, but for such problems, allopathy is the best one. So you should evaluate properly. So that's why I have seen many people having a lot of problems because lack of awareness, health awareness. So that's why I started educating them. I gone to the schools, even in my hospital also. I started running various programs. I'm having very many different programs. Even in 2020 for 1 year there were articles. I think I have written 26 articles on women in the Saka newspaper for the complete life cycle of female. So that was the reason, and I get phone calls, and my patients are very happy that they are knowing everything about them. Nowadays, even now this era, they are knowing everything about they know that with only one click they will know everything. But it is not like that. Many times they get misunderstood. So they should have a proper knowledge. That's why I'm working for that. I'm having Garbhoti Garbha Sanskar group, even the PCOS club. So girl used to, they should have exercise, they should have a proper knowledge of this entity. That's why it was like that, it started like that. And we have, having, that's how the book was written. There are 10 dramas in that. Sri Sakhi Arogya Samvad. I have written 10 dramas, and 3 dramas are on the stage. Already they were on the stage. And in future also, I'm planning to have more such things so that even the rural people also will get educated apart from that.
Okay, that's wonderful, ma'am. More about your Sakhi Arogya Samvad. I believe there are like 10 short stories, as you said, 10 dramas. So what exactly, because I believe you said there was something about phases of a woman's life. So
Yes.
what do you depict through those dramas?
See, the first one was an adolescent girl.
Okay.
So there are various problems. What I have discussed now, these are the various problems. Then another is from the infertility. Then means a childless couple. Another is for a pregnant lady. Then the cancer awareness. So many dramas are there. So it is very important that when if you give lecture, people just understand few things, but many things they forget. But suppose it is in the form of drama. If they watch a drama like that, then they will be very happy and they will understand the things more properly, and it will be get fixed in their mind. So that's the importance of drama. Very much powerful impact.
Okay, that's a very creative approach to that as well.
Yeah.
So now I'd like to move to your field of expertise. You're an infertility specialist and a hysteroscopist, alongside being a consultant gynecologist. So for those who don't know what a hysteroscopic copist is or what hysteroscopy is, can you shed some light on that, please?
Hysteroscopy is that way a new technology.
Hmm.
Hysteroscope, just see, hystero means womb. That means related to uterus. In Latin word, it is womb, related to uterus. Hysteroscope means to view the uterine with the help of telescope. It has started, long back, but it was not popular few many years. Even the last 10 years, 10, 15 years, it has become very popular. So the study started from the Western world, and then nowadays, even I have worked on that in 2014, 2016, 18, a big conferences, never before in India. I organized conference on that, national, international, and then everybody got to know what is the importance of this technology, that it is important for all age group, especially the girl is basically more commonly used for the childless females and the ladies having the abnormal uterine bleeding. So we can pass this telescope from this vagina. So nowadays we are not using anesthesia also. Patient can enjoy her surgery. It's a very small scope, 2.9 diameter, 2.9 mm, and we are introducing that scope through that vagina in the uterine cavity. So just I shown you the picture of uterus, if you remember. That's why I mentioned outer layer, middle layer, and in the cavity. So directly we are going in the cavity. So sometimes the lady is having the congenital anomalies, like she must be having the septum, we can say parda. In between the large parda is like that. It will divide the uterus in 2 cavities. So you can cut with the help of scissors. Patient can have small tumors or small fibroids which is in the cavity. With having heavy bleeding, we can remove it. So many things we can cure with the help of hysteroscope, and it's a very beautiful. Basically, I work on the save uterus concept. You know what used to happen previously? Any abnormal bleeding, 35 years, 37 years, people, there were no technology like that. Even 25 years back, even there is the lady suffering. They used to remove the uterus when the childbearing is completed. But it is not like that. It has its own respect. You can solve, you can cure, you can evaluate the uterus properly, and you can save the uterus. Suppose a simple fibroid is there, you can remove it, and the lady will be free of her symptoms. So that is the beauty of this technology. So that is a hysteroscope, very, very important in the female life.
Okay.
One is ultrasound, one is ultrasound, second is hysteroscope.
Hysteroscope. Okay, thanks for that. So I want to talk about PCOS again, but firstly, a lot of people are confused between PCOS and PCOD. People think it's the same thing. So what is the actual difference? Because obviously the abbreviation is polycystic ovarian syndrome, and that is polycystic ovarian disease, if I'm not wrong.
Yeah,
So,
it's a very good question.
so what is the difference between these two?
The layman, they always say that the PCOD. Ma'am,
Yes.
I'm having PCOD. There's a polycystic ovarian disease. But
Yes.
in a scientific word, it's a polycystic ovarian syndrome, PCOS. Disease, it is not a disease. Okay, it's a group of symptoms. Symptoms mean the patient having different problems. That's why it is called as a polycystic ovarian syndrome. Patient having different problems, and it is not disease. It can get cured. So that's why it's a misnomer. So ideally, technically or scientifically, PCOS is more correct. Polycystic ovarian syndrome.
Okay. And also, ma'am, about PCOS again. So, a lot of, like you mentioned that a lot of, there's this influence of weight. For example, obesity can, have links to PCOS, but sometimes people think it's only because of weight. You're fat, that's why you have PCOS. If you lose weight, you will get rid of PCOS. So, because since you've spoken so much about it, how correct is this? Because it seems like there are many more factors that are involved in this.
Yes, already I mentioned in my presentation. See, remember, I always counsel the PCOS patient. Even a trial is getting conducted in my hospital on PCOS. Okay, so always we counsel the PCOS girl that, see, this is the pattern of your ovaries because of different causes. There can be a genetic cause, there can be an environmental cause, there can be a insulin insensitivity cause. So many factors are there. And because of your obesity, again, it will get exaggerated. Okay, so it will not go like that. PCOS will not go. You have to control your problem, this PCOS. Always remember, many girls having this problem, or many women were having this problem. Always counsel them, this is the pattern of your ovaries. And very simple solution is simple lifestyle management. Though it is simple, very difficult to follow. You have to do proper exercise, proper diet.
It's
And
lifelong, right? So
yeah,
PCOS, is it lifelong?
it will start with menarche. That means the start of menses. It will end with menopause, but it will have after effects after menopause. Simple. I will say you. See, first turn, okay, means the 10 to 19 years. The girl will get irregular menses, then the excessive hairs, okay, then so many problems like acne. So these are the PCOS troubles. If suppose, and along with that mismanaged lifestyle, she will gain weight, again the problems will get worsen. Okay, if suppose she is going in the same next phase, then the reproductive phase, if she marries, there will be difficulty in bearing a child because there is no ovulation. The ovaries are very much resistant. No egg is forming. Multiple small eggs are there, but but not a single egg is getting matured. Okay, then she will have a difficulty in getting conceiving. Okay, even if she conceives, she will have it will be a high risk pregnancy. Firstly, because of her obesity and because of its problems. These ladies can have the diabetes in a pregnancy, hypertension in pregnancy, like this, and the difficult deliveries. And even if that is overcome, after 35 years of age, she will have again diabetes prone, she will have hypertension, then she will have metabolic syndrome, and after around 40, she will have excessive bleeding. So many things are happening. So that's why you have to control it with the proper lifestyle management.
Okay. Also, I want to speak about you. You mentioned something about insulin resistance in PCOS and some physical manifestations like on your skin. And can you speak more about that? Like, what are the implications of high insulin or insulin resistance? Sorry. Yeah.
See, what is insulin resistance? Whenever we eat something, whatever it, not only sugar, because our food contains sugar. When we eat it, our pancreas will secrete insulin and it will get nullified. They'll not increase in sugar. But what is happening in PCOS? There are some changes that are happening, and the few girls or women will experience it, and there is insulin resistance. It is not acting properly, so that these patients will have higher levels of insulin. Sometimes even that's why what is happening over the body, because of they get this blackish. I just explain you the blackish
Mm. Yes,
discoloration over
yes.
the neck. That's acanthosis
Yes.
nigricans, and that's why their ovaries, they are resistant to any stimulation also. It is not happening properly. The ovulation or the proper functioning of the menstrual cycle is not happening. So that is the main problem the girls are getting. Actually, it is sometimes very difficult to understand by the other these
Mm.
patients also, but it is something like that, that they are having this metabolic problem in their body. That's why
Okay.
they get this problem.
Okay. So, ma'am, also because you're an infertility expert, obviously, you deal with it mostly with assisted reproductive techniques like IVF, and you also head a test tube center.
Yes.
So, ma'am, but some people they have so many questions about it, like there are controversies, and that the child that is born through IVF may be premature, they may have this condition, they may have certain disorders, as compared to a child that is naturally conceived. So, how do you address these concerns? And is IVF for everybody? Is it safe for everyone who wishes to have it done?
See, first of all, just I will answer your question one by one.
Mm.
Okay, what is IVF? In vitro fertilization.
Session.
And whenever the patient is coming to us, all patients won't won't require IVF technology.
Okay.
So we have to select the patient accordingly.
Mm.
Now, what is happening? Why more and more people are into IVF, especially career girls? Because there is rising trend in infertility.
Mm.
Whether there's a conceiving also. Why? Because of the mismanaged lifestyle. First one, PCOS is one of the important cause. Okay, and then late marriages, then the career
Mm.
planning late.
Mm.
This is also important message I would like to give. See what is happening. You know, every girl should know that at the age of 30 years, her ovarian reserve is around 70 to 80%. Okay, 80%. That means ovarian reserve is to have a यानी एक बनने की क्षमता. Okay,
Mm.
ठीक है. That this ovarian reserve, it will be decreased to 50 to 60% at the age of 35, and again decreased to 10% at the age of 40.
Mm.
This is the normal statistics. But suppose stress, tension, PCOS, so many things are there, then this reserve again will go down. Nowadays, what I am observing, many girls, even at the age of 20, 29 years, having 30 years, less ovarian reserve. That means your ovary is not working properly. Her capacity to produce eggs is getting less. Okay.
Mm.
So that is the main cause. That's why I would like to give ki always consult your doctor, pre-marriage counseling and the pre-conceptional counseling, which is
Mm.
very important. This is the first question. Okay. Then secondly, there is no difference between the IVF babies and the normal babies. These are same.
Mm.
Only the
Okay.
things that why premature babies? Because already these patients having some different problems. Like
Mm.
suppose patient is having obesity because of
Mm.
increased age, more than 35 years, hypertension may be having. That's why
Mm.
so many factors are affecting her pregnancy. That's why
Mm.
she's having such problems, not
Mm.
because of IVF. Okay,
Okay. Mm.
so this is the main problem. So don't get misunderstood, because this is the normal pregnancies, and why there is a rising trend of cesarean section, because already age is increasing. There
Mm.
are so many other factors are there. So we need to, because this pregnancy is also precious, and we
Mm.
have to act very quickly for such ladies.
Mm.
That's why we are more concerned about their, because suppose she is having hypertension, many problems, suddenly she can have develop some problems, her baby may get affected. So we have to keep constant track of with the help of ultrasound over her
Mm.
pregnancy.
Okay, ma'am. Ma'am, also I've heard like, some people who they have, women, they have their eggs frozen.
Mm.
What is the rationale behind that? Why would you have your, like, is it because they worry that, okay, as you said, as you mentioned, your capacity to ovulate that decreases with age. So why not take them out and freeze them in advance and then, come back later? So what is the actual rationale behind that from a doctor's perspective?
From my perspective, being a IVF specialist, I will say, please see, unless and until there is some valid reason, don't do like that. Just like a fashion, just others are following, just film stars are doing, that's what we are doing. Don't do it.
Hmm.
Always remember, ki, why, if you are conceiving naturally, why don't you try? Why you are spending so much money as affecting your health? It is not
Hmm.
so easy. You know what they are doing with the egg freezing? They will give some injection. They will stimulate your ovaries so that instead of one egg, more eggs will be there.
Yes,
Okay?
yes.
And the eggs will be under anesthesia. They will retrieve. They will take out all these eggs and they will freeze it.
Hmm.
Okay? This sounds very simple. But we have seen there are other problems also. Unless you are exposing you with the risk factors like anesthesia, with the stimulating drugs, there are some other complications also involved. And another, unless you are exposing your eggs to the freezing techniques when there is
Hmm.
no need. Now, recently in 2022, one paper is there, scientific paper,
Hmm.
and it is saying it. Because last month I was in conference there, it was in discuss. Because of the freezing technology, there are the upcoming the generation, those with the conceiving with that, after in their lives they are having cancer more than these patient normal patients with the freezing. So until and unless there is some reason, don't go on freezing your eggs. Just
Hmm.
just have your life in a natural way. That is
Hmm.
my message for you. Unless suppose patient is having, girl is having some problem, ovarian cancer, and that is okay, but
Hmm.
not for that unnecessary. Just like a fashion or just I don't have time. That is not the reason.
Hmm. Okay. So, ma'am, lastly, I want to talk about your public health awareness again. How would you encourage, all those who are watching this to raise
Mm.
awareness around PCOS or any, condition that is related to PCOS, for example, PMS, or, there are many others, endometriosis. So, all of these things, as you've mentioned, that you are raising awareness for now. How would you encourage, those watching, all the youth that are watching you to do the same?
Yeah, very nice question, because I always say, see, I am doing a lot of efforts, but
Hmm.
many times I don't get that much response. What do I should get response from you people? You should get aware about yourself. That's why, I form a group on PCOS girls, PCOS of Central India. Okay, PCOS Club of Central India. So always I say you that with this media that you should have your health awareness groups. You
Hmm.
should discuss your health problems. And whenever there is a problem, I am always there to solve your problems. Anytime you can just call me, I will be there to solve your problems. But you should have your own groups. You should have a healthy sport activities. You should know your body, what is happening in your body. That is very important. So that's why always I believe that if the college girls take this charge, this is as a campaign to have a proper healthy awareness, even a walk for PCOS,
Hmm.
just like follow all the norms of PCOS to
Hmm.
avoid PCOS, just to kick the PCOS away from your life. So you have to maintain your lifestyle properly.
Mm. Okay, thank you so much, ma'am. So, with this, I come to the end of today's health talk with Sushma, ma'am. I'm really thankful to you, ma'am, for the time that you've set out from your schedule for us and for this wonderful and enlightening session that you presented, wonderful enlightening presentation that you put out there for us, and for your very wise words as well. Thank you so much once again for your time. Any last words? Any words of conclusion? Words to conclude?
Okay. Only the conclusion. See, uh, you are the only uh, important person to have a good life. You cannot blame others. So you should, as a student, you should understand your own life. In Marathi, very good saying, तूच आहे तुझ्या जीवनाचा शिल्पकार. Means you are the own person of your life who can lead your life properly. So always try to gather good things. Always learn more things. Always be studious throughout your life, and be a good human being.
Yes.
Cause all the just don't think about any religions. Cause be like a good human being. Always be like that.
Thank you so much, ma'am. That was very nice. So I hope that everyone watching this has thoroughly enjoyed what we have brought for you today. And once again, ma'am, thank you for coming on board and speaking about PCOS and many other conditions, their underlying factors, and in general for your very wise words. So with this, we come to the end of today's session, and I hope the viewers will join us very duly for next week's session as well. Thank you and have a good day.